So new tonight in our Rebound report, a Franklin woman stuck with thousands of dollars in hospital bills after testing positive for COVID-19. Charges that are supposed to be covered by insurance. When she got the runaround, she called our consumer investigator, Kristen Byrne.
Back in March, Sonji Millette and her husband went on a ski trip. When they returned home, they learned that they and more than 100 others were exposed to COVID-19. Both Sonji and her husband started having symptoms of the coronavirus, so they went to urgent care. It was the start of the public health crisis. Millette says testing for COVID-19 was limited.
They had at the time said you had to take a flu test first, and then you had to wait for those results to come back. And once they did, then you could call your doctor and ask to get the COVID test.
The flu test came back negative, but the COVID-19 test came back positive.
A day after I got that test, I went to the emergency room. I was having the respiratory issues.
She ended up feeling fine enough to return home where her husband was recovering too. They both quarantined. Charges for her and her husband totaled more than $2,000.
So I haven't seen a bill for COVID testing, but I've gotten the bills for everything else.
She paid several before realizing some of the charges they both had, like these nearly $50 flu tests and these almost $180 doctor's visits to get that flu test, she shouldn't have to pay. Not only did her company send a letter reminding employees their medical plan covers costs associated with COVID-19 testing, the CARES Act requires health insurance plans cover testing needed to detect or diagnose COVID-19. She called her insurance company, United Healthcare, who instructed her to call Ascension, her medical provider.
You need to change the code. And they're like, well, it's a flu test. It's the right code. No, it's the wrong code. And the way I feel is it's like, if it's not covered, then you gave me a test that wasn't necessary.
Then Sonji reached out to TMJ4 News. A few weeks later, after we asked why these tests related to COVID weren't covered, we received an email from United Healthcare saying it's reevaluating claims to ensure that care providers use COVID-19 specific diagnosis, and that Ms. Millette's claims have been reprocessed, waiving all cost share for this visit as part of this review. A spokesperson also told us it's working with Ascension to refund Sonji the amount she already paid.
The stress of having things go to collections make people just write a check.
Patient advocate Marn Sandom with Patient Care Partners says if you are billed incorrectly during COVID, pick up the phone and make a connection. Her colleague and founder of the agency, Debbie Deutsch, says consumers need to be their own advocates.
This is not time to be a shy little violet. You have to be really tenacious and write down who you've talked to. If there's a follow-up needed, do it. Follow up. If you need to go up the chain, be prepared to do that.
If you're not getting anywhere, you can reach out to an independent patient advocate. Their services will likely cost you money, but some, including Patient Care Partners, give free consults. Here's your Rebound rundown. If you're billed for COVID testing or any test used to diagnose COVID, you shouldn't be charged. Reach out to your hospital group and insurance company and go up the chain if you need to. Consider hiring a patient advocate if you can't get the bill resolved. For the Rebound Milwaukee, I'm Kristen Byrne.
Well, we also learned that Kristen reached out to Ascension, but the medical provider declined to comment on Sonji's case. Now, in this story online, you'll find helpful links answering COVID medical billing questions that you may have. So head to tmj4.com/rebound.